Welcome to Nutrition After GIST Surgery. During this seminar, all participants will be in a listen-only mode. There will be a question and answer session at the end of the presentation using the questions submitted through the Q&A feature. Please remember, the information provided in this webinar is not intended as a substitute for your physician's guidance and care. My name is Christina Oakes, Data Management and Resource Manager at the LifeRaft Group. And now I would like to introduce you to our presenter for today. María Camila Gomez has been a GIST patient since the age of 16 and is currently a sixth semester nutrition and dietetics student. 5 years ago, after undergoing a total gastrectomy, she recognized the vital role of nutrition in overall health. This realization led her to pursue studies in nutrition, both to better understand her new reality and to support others facing a similar challenge. In addition to her academic journey, María Camila creates social media content to raise awareness about life without a stomach and the importance of adapted nutrition. So, yeah, thank you all for coming, and I'm going to stop sharing my screen and let Cami share her screen and get started.
Thank you so much, Christina, for the introduction. Thank you, everybody, for your interest. Today, I'm in charge of talking about nutrition after a total gastrectomy. And before starting, I wanted to reintroduce myself. My name is María Camila Gomez. I'm from Colombia, from Barranquilla, and I'm a GIST patient since 2019. I got diagnosed with a stomach tumor in 2019, and I had a liver metastasis in 2024, and they did a cytoreduction. I'm also a third-year nutrition and dietetics student, so the idea is today to combine what I have learned through this process of being a patient, but also what I have learned like with these semesters of studying nutrition. So before starting to talk about the nutrition when we don't have a stomach, I think it's important to understand what are the functions of the stomach. The stomach is an organ that is part of our digestive system that stores food and also breaks it down into smaller parts. It also produces gastric juice, which is a mixture of substances that will aid our digestion, and this juice has several important functions, such as helping absorb vitamin B12, it breaks down proteins, it releases hormones, and it produces hydrochloric acid. In the stomach, the food will be turned as chyme, which is a semi-liquid mixture that moves into the small intestine in order to continue digestion. So when we talk about the absence of a stomach, we are usually talking about a total or a subtotal gastrectomy. So a total gastrectomy is when the stomach is removed completely. So the esophagus is directly connected to the small intestine, which completely changed our digestion. So we can see in the first photo that in here, we have our stomach, it has the tumor, and when they do the surgery, they connect part A, which is the esophagus, with part B, with part C, which is our jejunum, in order to continue digestion. But when we talk about a subtotal gastrectomy, is when only a part of the stomach is removed, usually the lower portion or a lateral section. The remaining part of the stomach will continue to function, but with a reduced capacity. So in this photo, we can see that the tumor is in here. So what they do is they leave a little part and they connect the jejunum, which is the first part of our intestines, to that little small of our stomach in order to continue digestion. In both surgeries, the digestive system will adapt over time, but it's important to have a proper nutrition in order to prevent nutritional deficiencies. So our intestine is the one that will readapt in order to continue the function of our digestive system. But as our intestine is not used to receive food without it first passing through the stomach, it's normal that without this step, our intestine will receive food in a more complex state, which may cause irritation. Also, our intestine has no capacity for distension. So that's why at the beginning we can eat, but really, really little portions. Also, there's no control over gastric emptying. Our digestive enzymes need hydrochloric acid, which is the one that is produced in our stomach, in order to function properly. So that's why in some cases we are going to have malabsorption of vitamins and minerals, and we are going to have an increased sensitive to temperature changes. The digestive system must readjust, and our intestine has to take on new functions in order to compensate the absence of our stomach. So, what happens in our body after a total gastrectomy or a subtotal gastrectomy? When a person has no stomach, body will adapt, but our digestion will change. First of all, our digestion will be faster, but it will be less efficient. Also, we're going to have dumping syndrome. We can have fatty stools and malabsorption, and also we have an increase of having foodborne illnesses. The first thing that we recognize when we start eating after a total or a subtotal gastrectomy is our portions are going to be very little. So as we don't have a stomach, our food will go directly to our intestine, which lacks of storage and distension, and so we cannot handle large amount of food at once. So how we will determine our appropriate portion size? At first, our portions are just gonna be a few spoonfuls. However, these will gradually increase over time, but it's important to listen to our body and its signals. What I did at the beginning was to change my big plates, like the normal plates, to smaller plates and eating with little knives and forks in order to help control the portion sizes. Also, how many meals should I eat per day? Since we cannot handle large amounts of food at once, the idea is to divide our meals every 2 to 3 hours so we can have, first of all, we can prevent malnutrition and weight loss because we are consistently receiving nutrients. Also, we are going to avoid nutritional overload, so we are going to improve our nutrient absorption. We are going to reduce dumping syndrome, gas, and bloating. So it's important that each meal that we are having includes protein, carbs, and healthy fats, all in appropriate portions. Also, when we start eating after a total gastrectomy or a subtotal gastrectomy, we are going to see that some of the things that we were used to eat now can cause us some intolerance. So how we will identify food intolerance? Each person will react differently to food intolerance. It is important to identify these symptoms in our body after consuming certain foods. These intolerance or symptoms can be, we can feel it with digestive discomfort, abdominal pain, or the feeling of heaviness. Also, we can have loose stools, excessive gas, and weakness. My tip for understanding and recognizing some intolerance is to keep a food diary and tracking symptoms, helping to identify patterns in food consumption. This will allow us to avoid certain foods or consume them in smaller amounts. The idea is that in this diary, you write down what you eat, at what time, and how you felt afterward. But if we cannot recognize the intolerance and we are having a lot of symptoms, there's also some things that can help us reduce the symptoms or alleviate them, which are drinking warm herbal infusions like chamomile, anise, and mint that can help us reduce the intestinal inflammation and alleviate discomfort. Also, the use of essential oils such as turmeric, mint, chamomile, ginger, and lavender can help us alleviate the discomfort and reduce inflammation. However, it's important to keep in mind that this type of medication needs to be approved by your treating physician, because in some cases, these type of herbs can be contraindicated for patients that are undergoing chemotherapy. Now, when we had a stomach, usually we are used to eating too fast. But when we are missing our stomach, the idea is to eat mindfully and like chewing, knowing what we are doing, being conscious of eating, because if we eat too fat, food will reach our intestine too quickly, and this will cause dumping syndrome. Dumping syndrome will give us symptoms like dizziness, sweating, tachycardia, nausea, and diarrhea. And also, eating too fast will increase the risk of not chewing food properly, and this will lead us to difficult digestion and reduced nutrient absorption. The reduced nutrient absorption can raise the risk of nutritional deficiencies. Talking about dumping syndrome, it's something very common when we don't have a stomach, and it's literally like the photo where a truck dumps a lot of food in our intestines, and our intestines doesn't know what to do with all of the food that is arriving really, really fast. So dumping syndrome is when food passes directly from the esophagus to the small intestine without the regulation that is normally provided by the stomach. This will cause food to arrive too quickly without the proper predigestion, and it will trigger dumping syndrome, causing symptoms such as dizziness, excessive sweating, and diarrhea that is known as early dumping syndrome, that is usually 30 to 50 minutes after we eat. But also we can have a late dumping syndrome that is 1 to 3 hours after we eat and has symptoms such as hypoglycemia, tachycardia, and tremors. For preventing dumping syndrome, the most effective way is changing our eating habits. We need to eat slowly, chew mindfully, and also avoid drinking liquids with meals. Also, we have to always pair our carbs with protein and healthy fats and avoid sugar and baked goods. And in the prevention, we can have divide our meals into small portions and avoid the mixing of multiple sources of carbs. However, there's also a anti-dumping formula for preventing the symptoms of dumping. That is, for example, if we want to eat a source of carb, in this case, a bread, which is a fast absorbing carb, the idea is to pair it with a source of healthy fat and a source of protein. In this example, the idea is to pair the bread, which is a fast absorbing carb, with an avocado, which is a healthy fat that will reduce and help slow down the absorption, and also pairing it with an animal protein source. This will help slow down the carb absorption, and we will reduce the symptoms of dumping syndrome. Also, there is an optimal eating order, which is start eating first your vegetables, then protein, and we will leave the carbs for last. In this way, it's like if our intestine is busy digesting first the vegetables, then the protein. So when we eat the carbs at last, it will reduce the blood sugar spike and carbs will be absorbed gradually. Also, we will, like our body will release insulin in a more controlled way, so we will have stable energy levels. The idea is that the optimal eating order and the anti-dumping formula, we combine it with drinking liquids 20 minutes after eating solids, so we can have a successful meal without the symptoms of dumping syndrome. But if we do these tips that I have just tell, but we are experimenting also the dumping syndrome symptoms, there's also a few steps that will help us feel well. For example, when we have a hypoglycemia, the idea is to consume a fast-acting carb in order to feel well. And the idea is that we need to avoid large amounts of added sugar or juices because they will increase the risk of a rebound hypoglycemia. In my case, I prefer using honey, a little bit of honey. I take like 15 grams of honey. I wait 15 minutes in order to the symptoms to ease, and then I continue like with my normal day. The idea is then that when we feel okay again, we eat protein and carbs to help recover. But if the symptoms doesn't improve, it's important to reach out to your doctor to help alleviate these symptoms. Now, when we start eating without a stomach, we recognize that the surgery reduced the amount of food that we were eating. So this will turn into lower numbers of calories our body is receiving. This will create an energy deficit that can lead to excessive weight loss and a potential nutritional deficiency. This weight loss is normal in the first few months, but the idea is that we can have some tips to prevent losing a lot of weight, and that is incorporating healthy fats in our meals. And these healthy fats are, for example, avocado, olive oil, nuts, peanut butter, so we can increase our calories and lose lose very little weight. Also, it's important to eat small, frequent meals throughout the day in order that we are consistently receiving nutrients. After surgery, I feel hungry again. After surgery, we are not feeling hungry again because hunger sensations are produced in our body thanks to ghrelin, which is an hormone that is produced in our stomach. As we don't have a stomach, the ghrelin hormone will reduce and will make feeling hunger less intense or different than before. So, how do I know when to eat if I don't feel hungry? It's essential to eat regularly, especially in the first few months, to avoid excessive weight loss. However, hunger will still exist, but it will feel different. That's why we need to follow a structured meal plan, which is key to keep our body nourished and energized. In my case, hunger doesn't feel like when I had a stomach. Now I know that I'm hungry and that I need energy because I start to feel headaches, irritability, and fatigue. Now let's do a little mini nutrition class talking about the macronutrients and its importance in our body. Starting with veggies, which are the foods that provide us vitamins, minerals, and fiber, and these are essential for overall our health and our digestion. In the veggies, we have examples such as kale, carrots, broccoli, and also we have fruits that are, for example, bananas, blueberries, kiwi, and they will help us have micronutrients like vitamins and minerals that will help our digestion. Now we have the groups of carbs, which are the foods that provide us quick energy and they will give us immediate boost when it's needed. In the carbs, we have examples such as bread, pasta, rice, oatmeal, quinoa. We have a big group of carbs that its main idea is to give us that quick energy. That's why when we have a dumping syndrome event or symptoms, we need carbs so we can feel great again. Then we have proteins, which are the foods that can help us repair and build muscles. In here, we have two types of proteins. We have the animal source protein that we have eggs, meat, chicken, turkey, but we also have some like vegetable source protein that we can find legumes, tofu, chickpeas, beans, that they will also help us repair and build our muscles. And for last, we have fats, that these are the foods that will provide us long-lasting energy. These will help us sustain our energy throughout the day. The difference between the fats and the carbs is that fats will give us energy, but it will be very like not as fast as carbs will give us. So the idea is that we use fats for having an optimal and overall health, but not in the case when we are having a dumping syndrome event. And in fats, we have foods such as nuts, peanut butter, avocado, olive oil, and we will prefer fats that help us reduce inflammation. So, now talking about the nutrition after a post-gastrectomy, it's important to keep in mind that nutrition always should be individualized because all of our bodies will respond very differently to our food. However, something that is a rule for everyone is that our diet must be based on minimally processed foods and that we need to avoid added sugars and industrial sauces. So the idea is that our plates and our food always are simple, fast, and minimally processed. For example, the idea is that in our plates we always have a source of protein, a source of veggies, and a source of carbs. These added to some fats, and we can have some fruits after our principal plate. Also, talking about the preparation and how we eat our food, it's important to avoid the use of flavor cubes and we need to replace them with natural spices because natural spices will help us vary the flavors of our meals without the need for additives that are harmful for our health. In the spices, we can have turmeric, ginger, cinnamon, garlic, basil, oregano, which will be some of the thing that will help us eating delicious and will help us vary without for example, the cubes that has additives that can cause us some diseases. Now, talking about juices and smoothies, we need to avoid the consumption of fruit juices and instead we can choose whole fruits because these will help prevent dumping syndrome and will provide essential vitamins to improve our health. So the whole fruit has the skin, which has fiber that will reduce dumping syndrome, and also it has vitamins that will help our health overall. We can have some smoothies, but the idea is that the smoothies has a great proportion of carbs, protein, and of fats in order to prevent dumping syndrome. Here I did some like a little table in which there are three columns. I have proteins, carbs, and healthy fats. The idea is to choose one food from each column to create a complete meal. For example, for breakfast, you can have for proteins, egg, for carbs, oatmeal, and for healthy fats, peanut butter. And these mixed with bananas or with blueberries or strawberry will be a complete meal. Also, following the optimal order eating or the anti-dumping formula, we're going to have a complete, a balance, and a great meal that will help us reduce dumping syndrome. Also, we can have here the example of a lunch that can be a grilled chicken with brown rice and with avocado, also with a big plate of vegetables or fruits, and using the anti-dumping formula or the optimal eating order, we're going to prevent dumping syndrome. So the idea is that this table can help ease the decisions of eating, but helping also to have a complete nutrition in all of the food we are eating. And now, last but not least, when we doesn't have a stomach, we know that there are some type of supplements that we need to take. Supplementation also should be individualized, and that will depend on your blood test and on what you have been talking with your treating physician. However, there's only one vitamin, that is vitamin B12, that everybody that doesn't have a stomach needs to take for life. Vitamin B12 depends on a substance that is called intrinsic factor. That this intrinsic factor is produced in the stomach in order to be absorbed. Since we don't have a stomach, intrinsic factor is not produced, and the vitamin B12 that we consume cannot be absorbed. This will lead to a deficiency that can cause anemia, memory loss, and fatigue. So that's why it's important that at least once a month we have a shot of vitamin B12, or we take a supplement, a sublingual supplement of vitamin B12. Thank you so much for your attention. Here are some of my social medias. We can get in touch in there for talking more about nutrition. Also, I share stories and I share what I eat and how's my daily life living without a stomach.
Thank you, Cami. Now, if anyone has any questions, feel free to put them in the chat and we can go through them.
Oh, thank you so much. I really appreciate the informative talk that you get. My question is about dumping syndrome. I think for some of us that we have stomach, we still experience that. And I want to specifically ask, is the type of food can affect the degree of severity of the dumping syndrome? For instance, if we talk about protein, let's say if someone consumes fish versus red meat, does it really increases the intensity of the dumping syndrome?
Okay, so thank you so much for the question. I think that the macronutrient or the group of food that increases the severity of dumping syndrome are the carbs, because these are the group of macronutrients that increases our blood sugar levels. So carbs are the ones that are absorbed immediately. So that's why the idea is that we need to pair them with a source of protein, because protein help release, absorb a little bit slower. So the severity of dumping syndrome will be less.
I see another question in the chat. Someone asked if you still take any medications related to GIST, such as Gleevec.
No, I'm not taking any medication because my GIST is an sdh-deficient GIST, so there's only surgery available. I was taking imatinib for 3 months, but after the genetic results came back, we realized that it was not necessary.
Thank you. And I see another question in the Q&A. Someone asked, what would you recommend for patients that go out to eat at a restaurant? How do you navigate the menu?
Well, usually I ask before going to the restaurant, I ask if there's an option of just eating vegetables and protein. But also, what I do is I ask to the, I don't know how it's saying in English, like the one that takes the,
Oh, the waiter or waitress.
yes, the waitress. I ask the waitress if there's a way that I can change, um, like the food I'm going to order. Or usually, I go basic and I always just ask for protein and vegetables.
Oh, someone else sent a question in the chat asking if you can expand more on the use of carbs.
Um, the use of carbs in, well, when we have a dumping syndrome event, or like when we eat like normally.
I think you can do both,
Okay.
just to cover all the bases.
Okay, so when we have a dumping syndrome event, usually what is happening is that we have a reactive hypoglycemia. So hypoglycemia is when we have very low levels of glucose in our blood. So our body needs a fast-acting source of carb in order to feel well again. So the idea is to take a fast-acting carb. For example, it can be honey, it can be juice, it can be sugar, but I will recommend always the use of honey in order to help our body. Usually, the amount of carb that we need to recover from a hypoglycemia is 15 grams. But if we eat something that has sugar or something that has like literally added sugar, maybe we're eating more than 15 grams and we are going to feel great a little bit of time, but past an hour or two, we are going to have a rebound hypoglycemia. So we will be like all of the day with hypoglycemia, then we're gonna be okay, then we're gonna have hypoglycemia again. So the idea is to take honey that is a little bit more safe. We are not gonna eat a lot of honey. So we are going to prevent having all day these rebounds that can affect our energy. And also, well, talking about like eating carbs all in our daily life, the idea is not to eliminate carbs, but to always pair them with some protein or with some fat. In that way, we're going to reduce the the time that it's absorbed, and we will reduce the probability of having an event of dumping syndrome.
Thank you. And we have another question in the Q&A. Someone asked, what are some questions that you could ask your doctor before a surgery like a gastrectomy?
I think that the most important question, well, I don't know. Like, I think that this is surgery that changes a lot in our body, and that at the beginning, like, it's really difficult to understand what's happening. But asking your doctor like how will be your recovery, that if you are going to have parenteral nutrition or nutrition like normal nutrition after the surgery, can help us like trace a goal on what are the things that we're eating. So for example, in my case, I start with liquids like 1 day after the surgery, but then 15 days after the surgery, I start with like smoothies or soups or things very safe to our to the reconnection they did.
Yeah, perfect. And I'll just add like one thing to that too. If you're seeing a doctor who's not a GIST specialist, you can always ask, or even if they are a GIST specialist, it doesn't hurt to get a second opinion. So if you are questioning a little bit your one doctor, you're free to go get a second opinion at another one. Um, any other questions? I know we're coming up on time here. Um, yeah, I think that's all. for today. Thank you, Cami. You've been very helpful, and I'm sure everyone else that's been listening agrees. Yeah, so thank you everyone for coming today. And if you have any questions, feel free to reach out to us at the Life for Active group. Thank you.
So much for your assistance.